Thanks, Sam.
What do you make of what the legislature did as far as fireworks laws this session?
It's very good. So as you know, I'm signing all of these laws that they produced, which will make things a lot safer. We're now going to be able to just apply fines to people who are shooting off illegal fireworks. It's going to be a lot easier to, toss in $300 fines. And I hope everyone will be careful and safe because as an ER doc, I treated a lot of burns. As governor, I witnessed this tragedy that happened on New Year's Eve that cost us the lives of 6 beautiful people. So everyone needs to tone it down with fireworks, and there will be fines for people who break the law.
You have until the 9th to veto bills from the legislature. Have you made up your mind on the intent to veto list?
I have on 90% of them. So I put 20 bills on the intent to veto list. We're going to just make some very gentle cuts, about $100 million out of the budget line item vetoes that we've discussed with the legislature. They've been great partners. There are just 2 bills, really, that remain that I'm wrestling with whether or not to veto. At the end of the day, I think I'll veto 10 bills, and 10 of those other 20 will go on and become law. They did a great job at the legislative level this year, but there's a little bit of dance going on.
Big news came out Friday. The BLNR decided to reject the EIS from the Army for the training areas at Polomoho, Kahuku, as well as Makua. What would you like to see eventually done with these lands?
Eventually, I'd like to see a smaller footprint controlled by the military and a lot of land come back to Hawaii. That's very important to all of us. Environmental stewardship and stewardship of the INA is critical, but we also have to keep in mind that we do a lot of important preparation for our troops for national security here in Hawaii. So we will definitely come to a compromise, but they will control much less land. We'll have land returned to us. And also there's going to be some added benefits that come to the state of Hawaii. So we're negotiating a master kind of agreement. I was not surprised at all that BLNR, who is the steward of the land, rejected some of the work that was not totally up to par for what we needed.
Medicaid is potentially on the chopping block with President Trump's, quote, big, beautiful bill. It would be $1.1 trillion in Medicaid as well as Affordable Care Act cuts that are proposed in that. How do you think this would impact us here in Hawaii if this passes?
We have 406,000 people on Medicaid. This is central to our healthcare system and keeping it intact. The bill is terrible. Right now, just so everyone understands, it's over $1 trillion of cuts to the healthcare system and the healthcare safety net. That means every state's going to see about 10% of their Medicaid population fall off of the rolls. Why would anyone do that to pay for super, super huge tax breaks for the very wealthy? It's completely misguided. 2/3 of Americans are against this bill. It will hurt us. They're also talking about cutting back SNAP benefits, food stamps, food support. Now, I will make sure that we keep as much of our safety net intact as humanly possible. That's why I've been going to D.C. to kind of mitigate some of these cuts. But you will see probably about 16,000 unnecessary and preventable deaths occur. 41% of women who are delivering babies are on Medicaid. Some of them will not have coverage. The biggest problem is when you take away Medicaid dollars, the rural healthcare system begins to crumble. So it's not just the people who are on Medicaid that live in rural areas like hospitals I worked in when I first came to Hawaii. It's also all of their neighbors because the hospitals end up closing, the clinics end up closing, the doctors or nurses have to move to urban centers, so people don't have access to health care. 1 out of 5 people are on Medicaid nationally. 1 out of 2 children in many states are on Medicaid. So any cuts are really uncivilized. Again, I'm going to work through some of the nuances of this bill, but it's going to be a long process. Hopefully, they'll put any changes out several years. I have worked closely with my team to find ways to kind of subsidize from our state side the safety net because it's too important to us.
So even if you aren't on Medicaid, if you live in a rural area on a neighbor island here in Hawaii, you could be impacted by these cuts.
Yeah, well, think about it. So in 2000, I came to Kau to be the doctor, and I covered Pahala Hospital, a rural critical access hospital. 70% of the people that went to this hospital or to my clinic were either on Medicare or Medicaid. If they make cuts so significant that the doctors like me have to leave and go to Honolulu, then not only do you have the cuts to the people who were on Medicaid, the 8,000 or 10,000 people, they may lose their health insurance coverage, but also that hospital won't have enough resources to cover and stay open. The doctor might have to leave. So then all the other people won't have access to health care, and they'll have to drive all the way, in this case, to Hilo, which is 70 miles away. And so what happens when some wonderful human being is delivering a baby? They may not have time to get to the hospital. What happens when someone else has renal failure? They may not be able to go to a facility that provides dialysis. So it's very cynical. What's going to happen is if they pass this bill and hospitals like Molokai General close or get cuts to them, this will hurt a lot of good Americans. There will be terrible consequences. Then there will be a political bloodbath in 2026. The Republicans, who are the ones voting for this thing, I'm not trying to be partisan, they're going to get jacked in the 2026 election. And then there's going to be a Democratic president in 2028 to repair all of this harm. We're going to have to heal this country. That's what's likely to happen. And I'll tell you, you already see some of the Republicans running for the hills, like Senator Tillis of North Carolina. He knows this is bad. Senator Murkowski of Alaska knows this is bad. In fact, about half of the Republicans know this is horrible policy to, again, cut the safety net, the healthcare safety net, to give a $3 trillion tax break to people who are already super rich. Why would we do that? So that's not who we are in Hawaii. We're going to make it through. We're going to negotiate the contracts with the military. That's going to bring resources here. I'm going to, protect our healthcare safety net. The legislature was smart and gave me some leeway and some cushion for the budget. So I can manage these things. But it is deeply, deeply cynical and ugly that they're passing this bill when the Americans don't even want it.
On a lighter note, negotiations continue for the new Aloha Stadium. Any updates there?
Yeah, so we gave them about a 6 or 8 week extension to finalize some of their contracts. There's a lot of things going on. One, new athletic director, Mr. Elliott, he's a great guy. He's coming over from the Hawaii Community Foundation, super smart. We have a lot of faith that he's going to be terrific. He's got a little kid. This is a good person. It's going to help us. Two, the contract with the brief extension doesn't really change the timetables at all. We're still hoping to begin the demolition of the Aloha Stadium, the older one, in the fall. It's going to be a lot of work. We have the $350 million to get going on phase 1 of the stadium. I continue to hope that we're going to have some other kind of angel come in and help us as a partner. A lot of conversations are in the works. The rail goes right through there. We'll get a new stadium around 2028, as you know, and that's important. That's also why I'm making some arrangements with Los Angeles. The Rams are really interested. The Raiders are interested. The college teams are working with us. We're going to have a football game against USC, it looks like. I mean, these are great things, and we want them to be dynamic. So we'll get the stadium. We'll weather this storm, whether it's the Medicaid storm or even you saw what happened in Los Angeles. They overturned the governor's use, and I stand by Gavin Newsom on this one and many other things. They overturned his use of the National Guard. And that's just not, again, who America is. If people are protesting peacefully, unless there's a full insurrection, don't take the National Guard away from governors. Let us use them for things like fires, when there's natural disasters. Let our police do their work. That was kind of disconcerting, too. So we're going through a real bumpy and turbulent time in America, but I want people to know they should have faith. We're going to be okay. It's just there's going to be a little bit of political combat going on, hopefully to fight for people and their needs.
All right, Governor Green, thank you so much for stopping by with us this morning and sharing your thoughts.
Thank you.
Aloha.